So we'll be starting the webinar very soon, but this is the pre-act, I guess, or the warm-up act.
Thank God you're not asking us to sing today.
No, but
not yet.
Well, I'm happy to join. I'll also bring up, I'm on clinical service right now, and one of our pulmonary fellows actually is from Flint, Will McClure. And so I kind of brought it up to him, and I said, oh, maybe in the future I'll bring him in, and I'm sure he'll love to like kind of join in as a kind of a resident, former person from Flint. His family's still there. So
what is his name?
Will McClure. Yeah. So
that last name sounds super familiar.
Doesn't it though?
That sounds very familiar. Yeah. I either met him or maybe someone from his family. Yeah. Very cool.
Yeah.
But that'd be awesome if he could be part of this.
Yeah. There's always space, and we love, especially for students. Yes,
and he's a fellow. He's training in pulmonary, so he'll be he'll be practicing in a couple of years by himself, independently. So yeah.
Very cool.
How exciting!
That's exciting. Was he an MSU CHM grad?
He may have. He did his residency in Cleveland Clinic. Or
I think he might have been a CHM grad. That might be.
But yeah, I think his medical school is
Okay. Awesome.
Doing some quick Google sleuthing.
Right? Pull your memory bank of like, oh, where do I know that person from? I do that so much now. It's like, is it from undergrad, grad school? I was a Teach for America fellow. Could have been that. I just catch myself doing that all the time. Like, I know them. I just can't remember from where.
Yes. Yes. And very often I know faces and then the names.
Yeah.
I'm the same way. I'm like, I know I can place that person, but you could give me 100 years, I won't come up with their name.
But while I'm doing it, my face is like, while I'm looking at them. It's not good.
That was one benefit of the masks, was I feel like it hid my reaction sometimes. One of many benefits, but
yes. All right, I'm going to put our slides up here and we'll get started in just a minute.
Will I be able to share slides? I made just a few.
You can.
Perfect. Okay.
Good afternoon, everyone, and welcome to the Flint Community Webinar, your community resource. We're so grateful that you've joined us today. So Dr. EJ, who's our normal moderator, will be here shortly. She got tied up a little bit, so I'm going to fill in for her while we get started. I'm Heatherlyn Uphold. I'm faculty here in Flint at MSU and glad to be with you. We have a lineup for you today. Maybe you have sick kids at home. Maybe they are just getting over being sick. Maybe you're sick. It feels like Somebody's got something somewhere. So we want to get your information needs taken care of, give you some good advice and some things to think about as we enter into the holiday season. So we've got some wonderful folks here who are going to answer questions. So start putting them in the Q&A so we can get to them. I see EJ is joining us, and I'm going to turn things over to her, but we'll let her get settled in. And I'll just walk through what we're going to be talking about and who we're talking to. So pneumonia, flu, RSV, pertussis, vaccines, all of those things. We're going to cover the gamut, but we'll also talk about what are some tips and resources to keep everyone healthy as we move through these holidays that are coming up. We've got Doc G is going to try to join us, as well as Nurse T, our wonderful community partners there, as well as Joanne Herman. You know her. She's from the health department and always brings us such wonderful information. We've got Dr. Ash, who's here. She jumped on the call. She wasn't even supposed to be on the call last time, and she jumped on to answer some questions. She's here to bring us some more information she's with MSU as well as Hurley. And we've got Michaela Benbow from the health department. She's going to talk about what's going on in schools. And then you may recall Dr. Stephen Huang came from, so he's a U of M person, but he came and talked to us about wildfires a few months ago. And we brought him back because he's a pulmonologist, and we're talking about lung health, and we want to have some expertise about what we need to know, how we can best take care of our lungs, and what are some treatment options if we get in trouble. So I'm going to turn things over to our first speaker. I see EJ's here. EJ, you want to add anything to that?
I just want to say, like, I might be out of a job soon. Dr. Uppel, like, what am I supposed to do with that?
No.
She's great.
Send me
over MC duties from now on.
Sweet Blair, send me back, bring in Joanne, and let's get the information started.
All right.
Thanks. Thank you very much. So Michaela is going to be sharing the slides with us. And we all know that this is a busy time of year right now, no question about that. And so I wanted to kick that off with just some really logical things about keeping our children safe in our community. And I know myself, I tend to multitask at times. And with that, I don't have my full concentration on all things, so things happen. And this is just a good reminder about how we can keep kids safe and healthy. Next slide. So just looking around the house. So some of us may have the Christmas trees up. We've got lots of decorations. You can see behind Michaela's background, she's got the lights going. And with real trees, make sure you're watering that frequently. If it's an artificial tree, make sure it's fire retardant. And make sure you're, with little ones, that your Christmas tree is flat on the ground. It's easy enough for them to tug it over. And if you're putting Christmas ornaments up, make sure those glass ornaments aren't at the bottom where they can grab them. And you want to keep things out of reach out of those little hands, and those little hands are busy at this time of year. So we're all lighting candles with that good scent, and make sure that they are under supervision. All the decor, all the glass elements, mistletoe, holly berries, poinsettias. Those are just a couple of things that can be in reach of kids, and we don't. Those are things that are not good for them to consume, and they do. They put anything and everything in their mouth. Small parts and little toys, and really be mindful of those little, especially those little button batteries. They can be, all batteries are dangerous, but those are really accessible and easy to swallow. So we want to be very careful with that. It's cold outside. The heaters and generators, keeping that CO2 poisoning prevention by keeping that outdoors. And the other thing is also with little ones, with their body surface areas, is dressing for the weather. They may not want to. It's really difficult, especially with car seats, how you have to take them out of the car seat and have the snowsuits off. But make sure that when they're outside, especially their head, you know, their feet, their hands are all protected. So they may persist and push back, but we need to make sure that everybody is dressed for the weather. Next slide. So lots of things going on in the house. I do a lot of cooking in my house, and really making sure with little ones that those pans, the handle is turned inward so somebody can't grab that. Heating the oven, making sure that's closed when you're opening the oven to make sure that's supervised. Lots of potlucks happening right now. So food safety is important. People tend to forget. You leave, cooked meats and other products, leaving them out, toss them after, your several hours. And people forget that you tend to have this all-day grazing period. So you want to make sure that you have food safety at the same time. Don't forget to wash your hands, and if you're sick, stay home. But one of the most important things that we can do, those are just common things, with safety, but the most important thing that we can do is vaccination. That is our best prevention against the post-holiday sniffles. Lots of activities, lots of close time with people, things are spreading, and if you've heard me before, you know that our vaccination rate is not where we want to as a community. And we've got a community that's vulnerable and we have individuals that are vulnerable. So that is number one for prevention. We can do all those other safety tips that I mentioned before, and those are important. But vaccination, number one. Flu vaccine in our county right now, only 17%. And that's all ages, but that is pretty darn low. That's for all of us. So we need to do a better job with our vaccination uptake. Measles, mumps, rubella, MMR. We are at 81%, which is still significantly below, 10% below what the immunity levels that we need it to be. So a lot of vulnerability with, especially with measles in this community. We haven't seen it yet, but we have had it surround us. We want to be careful with that. And that is a vaccine that is very preventable, and we are on the low end. We're going to talk a lot more about pertussis today and the DTaP, and that's a series, and we are even lower in our rate. Our DTaP rate is under 74% right now, and again, very vulnerable with pertussis on the rise, and we'll talk a lot more about that in the minutes ahead. COVID-19, it is on the lower end right now in terms of vulnerability in our community, but our vaccination rate has really dropped. We thought flu at 17%, while our COVID-19 rate for complete vaccination up to date is lower than 8% of us. So this is a time to get those vaccines completed. And just a reminder that our childhood vaccines, we are at our toddler age group, we're only at about a 70% completion rate. And our teenage vaccine rate is only at about a 75% rate. So we have a long way to go. And I think about all of you on this call. We have physicians on the call, but we have a lot of influential people in our community, and you have the influence. Not all people, when they come into the office, are getting those reminders. We'd like to think that we give that strong recommendation at every visit. But we don't want to lose a missed opportunity to talk about vaccines and to have that influence. For those of you that are not direct providers, you have a lot of influence in the role that you are in, and use every opportunity to remind people to keep themselves protected. Next slide. Michaela will talk a little bit more about what we're doing. We partner up, Michaela and I partner up a whole lot along with our health educator to really get the word out. But we look at data, and we look at it at a real granular level in Genesee County, and we look at to see where is our census tract, where is our zip code, what area has the most vulnerability. And this is just showing you a map that we do look at that. We look at it for different age groups, and we look at it by the geographic location. And we really tend to really do our outreach across Genesee County without question, but we really look at and pay attention to those vulnerable areas that we need extra attention. So I just wanted to share that with you, that we look at that. And sometimes you'd say, okay, it should be in the city. Sometimes it's out in the suburbs. So it's all over Genesee County, and it's not just one particular area that we can focus our attention, but it's quite spread out where we need to have our focus. So I would say as a community, we are just vulnerable across the board. Michaela, do you want to talk a little bit about some of the things that we're doing now especially with our school-age children?
Yeah, thanks, Joanne. I am going to talk about, make sure I'm on the right slide here. There we go. Yeah, I'm going to talk about our in-school health and what we've been seeing in our schools during this respiratory season, and what we can do to ensure that all of our students and families in Genesee County are safe and as protected as they can be during this treacherous respiratory illness season. So this slide you're seeing here is just kind of an overview of the things that we do when we're looking at school health. Schools and our pediatric and family doctors, like we have on the slide here, you all are really our eyes and ears as for what's going on disease-wise in our community. You all frequently hear about things happening much quicker than we do at the health department. So we're deeply thankful for having good relationships with our schools and our providers in this county, because that means we can all get the information we need much faster when we have open lines of communication and good relationships. So we're all very thankful for that at GCHD. Just some examples of the things that we do are we work very closely with our school nurses, both with me and with our communicable disease nursing team here. We are in contact with them at least one nurse, like I would say on a daily basis. Maybe not every nurse at every school, but we're in regular communication with our nurses. I just had a meeting with them a couple weeks ago and we discussed all of this stuff. So we try to keep in contact very frequently so that everyone is up to date and everyone feels confident that they're doing the best that they can to keep our kids healthy. We create some resources, and I just have a few examples listed here, and these are available on our website. So we have a school health toolkit that is quite a long document, but it is a digital copy, and people can pick and choose things that they need from there. We wanted it all to be in one place for schools to easily access. And then we also have a handbook on reporting diseases, especially as school staff changes from year to year. That can be kind of a little bit of a daunting process in the beginning once someone is new to reporting. So we wanted to make a really detailed handbook of what should be reported, when it should be reported, things like that. And again, that lives on our website and is available 24/7 for whoever needs it. And we also do things like we help schools craft letters of notifications when they get a case of a reportable disease. Pertussis is a perfect example. I have created probably 20, 25 letters, for schools, and we work together back and forth so we can get the correct information, such as, okay, how many students do we think were possibly exposed? What was the date of exposure? When we have younger children, especially for pertussis as the example, we want to make sure that we're able to recommend antibiotic post-exposure prophylaxis. Say that 10 times fast. And we want to make sure that we are correct in our recommendations for that. So we work back and forth with the schools to make sure that those letters are accurate and that they're getting to the right people.
Will you tell us one? I wonder if we could explain what you just said. Say that 10 times fast, right? The antibiotic post prophylaxis. And then if you could share the website too, just so that as you're talking, people can kind of see what you're talking about.
Yeah, most certainly. So a little cheat sheet that you'll hear me say is I don't often say post-exposure prophylaxis. You'll hear a lot of us call that PEP, which is, you can say PEP 10 times fast, no problem. But what that is in a household, if there is a person who was diagnosed with pertussis, they would of course be treated with antibiotics. And the current recommendation is that the other folks in that household, regardless of their vaccination status, they should also be treated with a 5-day course of that same antibiotic to prevent illness from spreading within the household. And that recommendation exists for a number of reasons. The biggest of which is that pertussis has a very high, what we call an attack rate for household contacts. Amongst non-immune exposed household contacts, the attack rate is about 80 to 90%. So without this antibiotic PEP, it's almost inevitable that those household contacts are also going to get sick. Which is why once we know we have one diagnosis, we can act quickly and put the household contacts on antibiotics as well to prevent the illness from happening.
So, Michaela, when you say amongst non-immune, you mean people who have not either recently had pertussis or been vaccinated against pertussis. Among that group of people who are in houses with people who have pertussis, it's like an 80% likelihood that you are going to get pertussis. Am I saying right? All right.
Yes.
But I see Gurbash or Dr. Esh Gurbash looks very excited about this conversation because I know this is something she sees every day. So she's up next, and I don't want to, you've got great information, but this is really important stuff, and I really appreciate you explaining it.
Yeah, absolutely. That's a great question. Yeah, and pertussis is it can be a challenging illness to combat at a public health level for a number of reasons, and that high attack rate is one of them. Yes, let me grab real quick our website, and I can drop that in the chat.
And I think when you've gone through all of this, I'd love for us to pull us all in and talk about the various spaces in which we're seeing and responding to this. Because I see Dr. Wong and I'm thinking, gosh, all of this is stuff that we see in the clinic, and this sort of overview that you're giving us about why we're seeing it and how that data is getting to you and why it's so risky for people who are unvaccinated is super helpful. So thank you.
Yes, thank you. Yeah, so moving right into that, I've got a slide on pertussis. Oops, of course I pressed the arrow too many times. There we go. So yes, what we're seeing at the health department level is pertussis is here with a vengeance right now. That is true for nationwide and across the state of Michigan. So it's not just us in Genesee County. We do have a lot more cases than some other counties do. I think that is not necessarily because there are more cases in Genesee County, but we at the health department and with help of providers and schools, we have gotten the word out there successfully that pertussis is around, and physicians are responding wonderfully. They're considering it in their differential diagnoses. Testing is way up, which is excellent. This is how we catch these things, and this is how we prevent them. So I'm happy and very proud of all the work that all of us have done in this county, getting the word out that this is here and this is what we can do to prevent it. As you can see on the slide, 93% of our cases in the county right now are in children age 0 to 17. And then 53% of those cases are in what we would consider school age children, so the ages 5 to 17. And when I looked yesterday at about 4 p.m., we had 153 cases of pertussis, which is astonishing. That is more cases than we have had in 10 plus years in this county. And even compared to the last time we saw a number this high was between 2010 and 2011. There was 167 cases. So a higher gross number. However, the incidence with what we're seeing now is much higher. We're seeing 153 cases in less than 6 months. So this is really the largest incidence we've seen in quite some time in this county.
Just a really quick question. If I'm reading this correctly, that means that about half of the cases that we're seeing in kids are those under 5, correct?
Yes. Yes.
So the highest risk kids, like the teeniest of the tiniest babies.
Yes, okay. Bingo. That is absolutely correct. Yeah, so we've had a number of our daycare centers in the county be affected by this. Obviously, a number of our schools, I think 15 plus school districts have seen at least one case. So yeah, it is quite widespread. And this can be a difficult illness to combat for, like we talked about, the high attack rate. I think another really big factor in the pertussis outbreak that we're seeing right now is also kind of the nature of the illness at the beginning. And we have obviously some physicians on here who can speak to this much better than I can. But with this illness, it acts almost like a common cold type of presentation for the first 1 to 2 weeks, right? That mild dry cough. Sometimes kiddos are fussy. They can have a fever in the beginning. We have not seen a lot of that reported to us though. The sniffles. And then at that 1 to 2 week mark, you start getting what I've called to myself those pertussis hallmarks, right? That's when you start to hear that whoop, where that whooping cough name comes from, and you see that post-tussis vomiting a lot of times with little ones, the apnea, that type of thing. So we're seeing about a 2-week time span between onset date and referral date to the health department. And unfortunately, that whole time, like from the beginning of that very mild cough, that kids are contagious during that time. So it can be challenging, especially for parents, right? I wouldn't necessarily think off the top of my head, my kid starts to cough, I'm not going to go immediately to pertussis, right? Like that's that's probably not going to be my first thought. But I think that also has contributed to the higher numbers that we're seeing. And also, we're not used to dealing with this at this level in our community. This is not the norm for us.
So I wanna highlight the importance of that point, because I think it is important for us to understand that vaccinations have done their job, right? Vaccinations have done a really good job of making sure that our kids, our vulnerable populations don't have to navigate illnesses that are really hard and that we can sort of almost eradicate. And I think it's important for us to understand from that perspective, because we have some context for pertussis. It's hung around enough that we still know, and all of the physicians still understand immediately how to treat. And the treatment is an antibiotic that is around and used for other things. The worry and the risk to our populations is that if we don't vaccinate for things like measles that people haven't had to treat for decades, that we won't have medications in stock to treat measles or other illnesses that vaccines have presented, and that we won't have physicians who have treated this as a bread and butter disease and know immediately what to do. That is not to say that our physicians aren't appropriately trained. It's to say that it's a difference between something that you treat weekly and something that you see once every 5 years. And I see Dr. Ash unmuted, so.
I just wanted to make a couple quick comments. I will always be the advocate for the very tiny babies. And so even if this is a very easy to treat illness, those teeny tiny babies can get really, really sick. So Michaela mentioned something called apnea. Apnea is when a baby stops breathing, just completely stops breathing for longer than 20 seconds. It's very scary. Oftentimes their lips, their tongue will turn blue, and they'll look kind of limp. They might become pale. And the babies who are under 6 months of age, more often under 3 months of age, are the babies that get apnea from pertussis. So even though it's a pretty easy thing to treat, we have to think of all the consequences of, and those are the teeniest, tiniest ones are the ones who can't get vaccinated yet, right? So part of vaccination is protecting the ones who can't get vaccinated as well. And just to comment off of what Dr. EJ said, it's not that we're not well trained, it's that we don't see this stuff anymore. So my attendings did lumbar punctures on so many kids before one of the vaccinations against Haemophilus influenza type B, which is a bacteria that causes really bad meningitis and a number of other things. So infection of the brain, essentially the brain and the spinal cord. So my attendings did this stuff all the time. They treated, they saw it, and they saw it very often. And these are things that I have been fortunate enough in my career and my training not to see, that we're seeing again. And so we will show up, we will take care of kids, we will treat them, we will save lives, but we also need to prevent these things from happening. I think that's really the biggest thing.
Yeah, I couldn't agree more. When we can prevent, that's the road. That's our best road. That's our best practice, gold standard, whatever kind of pretty name you want to put on it. Yeah, totally agree. Prevention is best.
Yes. And I see Dr. Huang unmuted too. And if I'm saying your name incorrectly, please correct me.
No, perfect.
Okay.
Yeah, I just wanted to add and echo what has been said too. We often think of these viral illnesses as, they often start as common colds, and maybe for the majority, people do, get better, pretty quickly. But for a good percentage, many people can get really quite sick. So we often sometimes, think, oh, these viral illnesses are just, common colds. They just kind of in the upper respiratory tract, but they actually do get into the lower respiratory tract, cause pneumonia. This whooping cough can affect the airways, and as Dr. Garbash mentioned, it can lead to apnea and be really pretty serious conditions. So, and it's not selective. I mean, it doesn't matter kind of where you're from or who you are. It kind of affects everybody. So anybody who can be exposed to these viruses, there's always going to be a percent that can actually get really quite very ill. And this pertussis vaccine, it's part of the Tdap. So even certainly for the kids, but even for the adults, I mean, just think of, we're supposed to get a tetanus shot every 10 years. This helps us protect against, when I step on that nail, I want to protect myself against tetanus. So every 10 years, we should be getting the shot anyways. And this is a good way to just say, oh, it's time for that tetanus shot, add in that pertussis, because it's all part of it, Tdap as well. And it just kind of protects us, routinely lifelong. Yeah.
And the last thing I'll add, that's such wonderful information, Dr. Wong. Thank you for those points, is if you're around little kids, ask your primary care doctor if you need to get an update on your pertussis and your tetanus shots. Those are really important things. And I see my health department people nodding their heads, and I'm going to turn it back over to them because we sort of hijacked the conversation. But I think these were really wonderful points. I really appreciate you, Michaela and Joanne, for giving an overview of this.
Yeah, thank you. Yeah, I was just gonna switch gears a little bit into, and Dr. Huang noted this a little, just talked about it a little bit, into pneumonia, because we know, right, as Dr. Huang beautifully said, these things that start in our upper respiratory tracts, right, like they can linger and get into the lungs and cause these pneumonia type illnesses. And we are seeing increased cases of pneumonia in our pediatric populations. And I feel so, it's like almost like, of course, duh, like we have all these lovely clinicians here that are like, yeah, I could talk about this, probably till the cows come home. But we're seeing it and at the local health department level as well. There has been significant increase in pneumonia, and particularly mycoplasma pneumonia, which typically affects younger children, our school age population, again, that 5 to 17, also our younger kiddos too, really that 0 to 17 population. Schools are an excellent breeding ground for illnesses, especially respiratory illnesses. Lots of kids all together all day long, breathing and playing and all things that kids need to do, but it definitely comes with some germs. The germs don't stay home. They get on the school bus and head right to the school as well. So pneumonia, especially mycoplasma pneumonia, can be a little bit tricky to keep the pulse on at the local health department level, because mycoplasma pneumonia is not what is considered a reportable disease. There is one type of pneumonia that is considered a reportable disease in Michigan, and that's streptococcal pneumonia. And what I mean when I say reportable disease is that when a case of that type of illness, and the streptococcal pneumonia, for example, here, those cases have to be reported to the local health department at an individual level. So we're easily able to keep a pulse on that when those things are coming to us. With mycoplasma pneumonia, that is not considered reportable. So it doesn't get as much surveillance at the local level. Statewide and nationwide, it is monitored, but not typically at the local level until you have something like we're seeing right now in this increased incidence. So we were given a directive by MDHHS that if we are made aware of any cases or clusters in schools or things like that, that we should report them to the state health department. So we are doing that, and that I have that trickled down to the schools, and that's where having a good relationship with your schools is really important, because when I got that directive from the state, I was very easily able to reach out to the school nurses and let them know, hey, if you guys are hearing about this, please let me know so we can work on it together. So we have had schools see cases of pneumonia. I have just check my notes here to make sure I say the correct number. To date, we've had 6 schools report at least 1 case of pneumonia. And 2 of those schools met the criteria to be considered a cluster, which means they had more than 1 kid in the classroom with pneumonia. So those got reported to the state of Michigan, just so we can have that enhanced surveillance. And I am happy to report that these students have since recovered, are back in school, feeling healthy, which is wonderful. And that's why we're doing this heightened surveillance at the local level, so that we can provide more support to our clinicians and our school nurses with combating this, right? So we can let the schools know if kids are, showing signs of illness, right? Maybe if it's within our capacity, we can increase the cleaning. We can limit the kids interacting with other classrooms. Like these type of just, they may seem like small interventions, but it really does help in preventing the spread of these illnesses. And so once we're aware of what's happening and we're having schools report it to us, we can provide that support. I did want to mention, and I'm sure our docs can talk about this much more than I can. I didn't realize before this notification from the state, I didn't realize that when you hear the term walking pneumonia, that this is the term that is the one that is mostly associated with the mycoplasma pneumonia. So I got to learn something in this, which was very helpful, because I did not know that before.
And I think that's a wonderful, it gets to that idea that we were talking about earlier around pertussis starting with common cold symptoms. Part of why, and for Dr. Esch, the younger babies often will have worse symptoms, but in our older kids, where mycoplasma used to sort of cluster around, sort of the adolescents that, 10, 11, 12, usually 12 to, teenage years, kids would walk around with it, right? So they weren't as severe. They weren't necessarily in their beds, with terrible symptoms. They would walk around with sort of this cough and a little bit of fatigue. And it really gets to the idea of, okay, sometimes these symptoms can seem really mild at first. Dr. Ash?
I absolutely agree. I will say, with this outbreak or whatever you want to call it, I have been seeing sicker older kids too, more often than not. And I'll touch on this when I talk about mycoplasma, but yeah, definitely.
Yeah, I can echo that in reports that I've gotten from schools, Dr. Esch. We had one of our school nurses reported, when she reported the increase in pneumonia at their school, they had 9 students out with it, and 3 of them were hospitalized.
Yeah.
I'm again super happy to report that luckily they weren't hospitalized for too long and they were able to get much better and back on their feet. But yeah, scary, because that's not typically what we see. But with it being in higher concentrations around our community, we know that is going to have a deep effect on some of our kids who are going to have those severe complications and need to be hospitalized. Definitely. Just make sure I covered all my notes. That was all I had for pneumonia. I'm going to switch to my next slide on influenza. I'm happy to report with influenza and with COVID at this time. I have COVID on the next slide, but these are these are our illnesses, right, that we're much more familiar with, either fortunately or unfortunately. I guess that could go either way. That we're more familiar with them. But for flu and COVID, these, as far as schools are concerned, are a little bit different in the reporting process. And by that, I mean that for both influenza and COVID, these are reportable illnesses, but not at the individual level. Schools, as part of the public health code, are required to report these two illnesses on an aggregate level. So each week, our schools report how many students they had out due to either confirmed flu or what we like to call influenza-like illness. Not every child, as we well know, we saw this happen with the landscape of what happened with testing with COVID. Kids are not always tested for the flu or for COVID nowadays. So in order to capture the more true burden of flu illness, we include that influenza-like illness, and we give the schools like a criteria for that, so they know what is like what we would consider influenza-like illness. So they report that to us on a weekly basis. And what you're seeing on the screen here is a graph of the current school year, the aggregate number reported by all the schools and daycares across the district. So you can see that the line is like a little bit bouncy. There's some like little hills in there from week to week, but you can see that there is an upward trend here. Which makes sense. This is what we would expect as we get further into flu season. We are lucky thus far in Michigan and Genesee County. We have seen so far pretty minimal flu activity, at least as far as the lens that I'm looking through that gets reported to the health department. I do just want to point out really quick right here, sometimes there can be a little dip in the reporting. Those line up. This took me a while to learn. I should have realized this sooner. But those little dips align with when the schools take holiday breaks. So it'll be funny if you ever see this graph extended out to like this week here, it'll look like 0. But that's because schools are not in session, so they're not reporting that week. This little dip aligned this year with the Thanksgiving holiday. So I would kind of consider this like an outlier. These other dots around here from week to week are more of an accurate representation there. But I always like to explain that because I'm always like, oh no, that looked like a great week. What happened here? But yeah, this far in flu season, we're seeing much more subtype of influenza A versus B, which is exactly what we would expect. Flu season starts out strong with subtype A and then transitions more in the end to seeing a higher concentration of subtype B. So we are exactly on track with what I would expect to see thus far in flu season, which is great. I'm glad we're not having anything crazy so far. And I think Joanne mentioned in one of her slides, our overall rate so far of flu vaccination for county residents is about 17%. It's not too late to get your flu vaccine. I hear sometimes anecdotally that people worry that once, oh no, it's already December, it's too late, definitely not. Definitely still, I'm glad I see all the docs agreeing.
No,
like, still get your flu shots.
Yes, I'm so glad that you said that because there's we really see flu cases pick up, I wouldn't say mid to late October, right? And it tends to be the season has what's interesting is we've seen sort of different life cycles and a little bit of changes post-COVID, longer life cycles of when flu is likely to happen. Our respiratory season seems to have shifted forward a little bit. And so certainly now, January, February, we're going to continue seeing this stuff. And certainly before you travel for the holidays and you're mingling with lots of other people who might have kids and little ones who are, petri dishes,
Right?
and opportunities to get sick. I love kids. They're still petri dishes.
Yep, absolutely.
The last few years, we've seen many times peaks of flu season occurring in February, March,
Yes.
even April. So getting vaccinated even now actually can protect you for kind of the rest of the really winter starts kind of, January. We've had kind of a well, kind of cold past few days, but this is kind of a good time to get it now. It's not too late at all.
Yeah, absolutely. And that's what we've seen the past few years. We're really seeing that peak times late January throughout February. So yeah, definitely not too late. If you haven't gotten your flu shot, you've got time. And lastly, I'm going to share, I have a graph for COVID as well. COVID, obviously, we have seen over the past 4 years, guidance and reporting rules change, right? As the landscape of COVID-19 as becoming an endemic illness here has changed. COVID-19 used to be reportable on an individual basis. That changed when the federal emergency ended in May of 2023. That's when we had that switch over to aggregate reporting for COVID. So like I said, with flu, schools do the same thing with COVID. They report their aggregate number of kids out with COVID-19. I do want to point out that I really think that this graph is not super representative of the true burden of COVID-19 illness. And we know that because we know that testing has really dropped off with COVID-19. What I think tends to happen is that a lot of what we would find to be true COVID cases, if we were still having high levels of tested, I think a lot of those illnesses are getting reported under the influenza-like illness, because we know that the symptoms can be pretty similar between COVID-19 and influenza. So that's just kind of something to keep in mind. So we're kind of seeing on this graph on the screen the opposite of what we're seeing with flu. Flu we know is trending upwards right now. COVID-19 is, according to this graph, seems to be trending downward. We had a little bit of higher activity of COVID-19 during the summer months this year than we have seen in the past few years. So that was something a little bit different. But as far as true confirmed COVID-19 cases being reported, this is what we're seeing as far as the school year goes so far.
I'm going to answer the question really quickly. Someone asked a really good question. How do you know the difference between flu and COVID? It's super difficult to tell. They have very similar symptoms. You can get like high fevers, body aches, joint aches, chills, cough, runny nose, congestion. The main way to tell the difference would be to get tested. If and I will say we test a lot, but in terms of the flu, we, at least in pediatrics, only treat the like highest risk people. So it's hard to tell the difference, but if you get tested, you might be able to know.
And it's important because it's time limited, but there are treatments for both that we might consider depending on your own medical history. And those treatments are very sensitive to when you tested positive and how long you've had symptoms. So the earlier in your treatment progression that you can test, the earlier we can consider potential treatments.
Yeah, absolutely. And I totally, as an epidemiologist, I am very, very much an advocate for testing as well. That gives us the most accurate information possible. So anytime that you can get tested, that's what we encourage as well. Yeah, let me just make sure I didn't miss anything. I always have to refer back to my notes. Oh, the last thing that I just wanted to point out with COVID, and I think that most folks know this nowadays. It's been a while since this guidance changed, but I just want to make sure to mention it because we have seen such changing guidance, as the landscape of COVID has changed. Currently, there is not at the CDC level specific guidance for COVID-19. The CDC, when the federal emergency ended, shifted more towards general respiratory illness guidance. So that is what, when we get questions about that at GCHD, that is what we follow, which is in alignment with the Michigan Department of Health and Human Services, and like I said, the CDC. So there is still recommendations for when folks are feeling symptomatic to stay home, and what have you. But the biggest change that I still sometimes hear lingering questions about is that there is no longer a recommended quarantine period for folks who have been exposed. And I tend to get questions about that, and the reasons for that. And folks, of course, everyone chime in, because I'm sure we all have different, every different things to add, but we have a lot more capacity now to handle COVID within our hospitals, right? We're no longer at the point where our hospital systems are overwhelmed with COVID-19 patients. We have COVID-19 vaccinations. So as the tools that we have to fight COVID, we get more tools, we get better tools. We're able to have those kind of work in place of that quarantine that we really relied on heavily at the beginning of the COVID-19 pandemic, when we didn't have as robust of tools.
I think, yeah, Michaela, I think that's a really good explanation of sort of what we're benefiting from. And I want to hear from Dr. Huang and Dr. Esch, and then pass it over to Dr. Esch to talk more about her section. But I do think you're spot on. I think both, we've got a little bit of existing vaccination. There's also the component of what we call sort of natural immunization, or enough people have gotten COVID and they've got some sort of, immunization or natural immunization from having had COVID. And that, from a society standpoint, from a public health standpoint, from a group standpoint of people in your community, there's a little bit of existing immunity. That means that when you get COVID, it's not as severe for some people, which does not mean it should stand in place of our vaccinations. It does mean that in general, for a society of people who might be younger, who might be able to navigate illnesses, that if you've had it, you've got some natural immunity that doesn't necessarily land you in the hospital the way it did when we were all sort of new to the virus and experiencing it for the first time and overwhelming our health systems. And I just want Dr. Huang to have one last point on that, and then I'll hand it over to Dr. Esch.
Yeah, no, I mean, we often kind of we think back at COVID as, a lot of kind of, stressors and even some failures on some ends. But I think we could actually even think of some of the success aspects of COVID. I mean, from a public health standpoint, because of vaccines and because of, immunity, we are now just so much more immune to COVID. And I think that's why we're learning we can now kind of live. The virus isn't going to go away, but we now know how to kind of live with it. And in fact, that's why we're actually talking about some of these other viruses, because these other viruses have just as much of a role in our health too. And we don't want to kind of forget about those. And really, we're learning how, as a community, how to kind of still do the things we want to do. We want to spend our time with our family and, spend time over the holidays, but kind of navigate things as, safe as possible with just kind of the right balance.
Thank you so much. And thank you, Michaela and Joanne. Michaela, that was wonderful. Like, I'm going to ask you now so that you can't say no, but we got to bring you back like on a regular basis.
My pleasure.
Phenomenal. All right. Super appreciate you both. Dr. Esch, please take it away.
Awesome. Yes, thank you. You touched on a lot of very, very important things. I am going to answer a question really quickly that we had live. Someone asked, why do we feel ill, or why do we get sick after we get vaccinated? And that's a question I get often, because I have parents oftentimes say, my kid got super sick after that vaccine. I don't want to get it again. And my answer is always, it's a wonderful thing if you start to feel kind of icky after your vaccines, not to make you feel worse or to make you feel bad. So you have cells in your body called white blood cells, and those are your immune fighter cells. They're the teeny tiny cells in your body that fight infection essentially. And when you get a vaccination, so you get the shot, those white blood cells come out and they get ready to produce memory cells essentially that will remember that illness, and they'll remember how to fight it. So you get a shot, your white blood cells come out, they start to produce these cells that are going to remember that illness. And the way that you know that your shot is working and that you're producing those cells is you might get a fever, you might get chills, you might kind of feel a little bit, down, tired, fatigued after getting a vaccine. And that's just your body doing exactly what it needs to do. And then you should feel better within the next couple of days. So feeling kind of sick after vaccine shouldn't last longer than a day or two. If it does, you should call your doctor. And they can help you decide whether or not that's still a normal response or something else is going on. But that's a great question. I get asked it pretty much every single day. So thank you. So I'm just going to go over very briefly, I'm aware of the time, just to kind of talk to you about what if I were to talk to anyone about what a pediatrician I would want them to know about the respiratory season. So I think the number one thing I'd want you to know is when to go to the ER. So when to take a kid to the ER. I, as a pediatrician who works in the hospital, give this advice all the time, and I use it for my own kids. If your child is not acting like your child, that's the number one thing I say to parents. So you know your kid best, and if something's just not right, I will say parents' intuition, gut feeling, I trust it as well in myself, and I trust it in the parents of the kids that I take care of. But if a kid is lethargic, so not waking up, barely waking up, super, super tired, doesn't want to even get off the couch to eat or drink or, feed if it's an infant. If the baby is less than 3 months, not making at least 6 wet diapers in a 24-hour period. And if they're younger than 12 months, older than 3 months, at least three wet diapers in a 24-hour period. So a diaper every 8 hours or peeing every 8 hours. If they're refusing to drink, so oftentimes our little toddlers will do this, or even our infants. So they'll just say push the bottle away or push mom away or whatever it might be. Or if they're not keeping anything down. So if they're vomiting, and you give them something and they vomit again and they're just not keeping anything down. Some signs of dehydration, their lips might be cracked, their eyes might be sunken in. They just look very, very tired. If they're vomiting and having diarrhea, and it's greater in amount to how much they're drinking. So peeing less could be a sign. So dehydration. And then if they're struggling to breathe, I am going to show you a couple of videos right now of babies struggling to breathe, because this is also something that I get asked all the time is, what does an infant or a baby in respiratory distress look like? So this is the first one I have. This is a baby who we'll talk about what you see in the moment. You can see that here, this baby is pulling or tugging, having retractions, and their head bobbing. Their head is going up and down. Those are both very, very common signs of respiratory distress in babies. I'm going to show you another one. So this baby is also having issues breathing. You can see that this baby is head bobbing as well. And you can't really see quite as much of the lungs, kind of the chest tugging, but the head bobbing is another sign. You even kind of see their nose flaring. That's another sign of respiratory distress. And then I'm going to show you, I like to show many videos because I just feel like it's really good to have the context. So give me 1 second. I'm going to show you my last video that I have. You can see this baby is doing all of those things too. So you see here on their chest, you can tell that they're pulling, they're tugging, they're really struggling to breathe. You don't see the head bobbing quite as much, but hopefully you can appreciate that they're struggling to breathe as well. So those are the videos I have for you. So pneumonia, we talked a lot about pneumonia today, but pneumonia is just an infection of the lungs. So you have an upper airway, which is, I like to think of it as like the neck and up, and you have a lower airway, which is your chest or your lungs. Pneumonia can be viral or bacterial. Bacteria are something that we treat with antibiotics, and viruses are infections that we treat not with antibiotics. We treat with many other things. And I will say viral pneumonia is something that we often see in kids way more than bacterial. So kids who are having trouble to breathe, have fever, and the illness has kind of gone down into their chest, we call viral pneumonia if it's a virus. You can prevent pneumonia. We talked a little bit about this already today, so I won't spend much time on this, but vaccination can prevent certain types of pneumonia. So walking pneumonia, what is walking pneumonia? We have been seeing it a lot, as Michaela kind of mentioned. As an inpatient pediatrician, so I work at Hurley in the hospital, I have been seeing this a lot, but really what I want you to know is that we're seeing it a lot in little ones. So school-age children very often get this. It's something that we see every year in school-age children, not in the numbers that we're seeing. But I think the kind of different part of this, the part that has pediatricians kind of looking out for this a little bit more, is that we're seeing it in kids less than 5 years of age. And so it's kind of coming back into our differential, if you will, meaning we're thinking about this in the little ones when we previously might have not always thought about this. I think the other big thing I'd want you to take away is that this is an illness where if, say, I got this illness, my kid might not get it until for like another 2 to 3 weeks. So it takes a long time to transmit to someone else. So if you or someone you know has noticed, hey, my kid got this fever and cough and they've had it for a couple of weeks and now I'm feeling sick and I have a fever and cough. And then 2 weeks later, someone else in your family gets sick. You guys might have walking pneumonia and it might be worth talking to your doctors to kind of figure this out together. It oftentimes starts with like a cough, fever, fatigue, sore throat. You might see some funky rashes here and there. And that's kind of how it starts. But then the biggest thing is that this cough can linger for such a long time. And that's usually the number one complaint I see. So if you have a cough or a kid who has a cough that's been lingering around for about a week or longer and it's not getting better, or, you have that kind of gut feeling, I would take them into your pediatrician. And including those under 5. So that's something that, again, is something I want to highlight, those little kids. And then RSV is something that we see oftentimes around this time, October to March. I will say I only just started seeing it in the past month. RSV for most of us are just cold-like symptoms. I actually had RSV a year ago. My son got it. And the reason why I know I got it was because my son had it and tested. But I had a cough, congestion, maybe a fever of like 100.5. But I was fine. And he actually got a little bit sicker. But the little ones, so these are kids under, especially the age of 6 months, may get very sick. So the thing we worry about for RSV and little teeny tiny babies is something called bronchiolitis. Bronchiolitis is just kind of a medical term for inflammation and congestion of those small airways of the lungs. So your lungs have a big airway and then 2 a little bit smaller airways and then many teeny tiny airways. In kids, those teeny tiny airways have a higher chance than you and me as adults getting inflamed and congested. So that's more what we worry about. And then in RSV, symptoms usually get worse before they get better. So days 3 to 5 are generally the worst in babies. And the babies that are highest risk are your small babies. So those that are 6 months of age or younger, premature infants. So if you know or have had a baby born before 37 weeks of gestation, babies that were born with heart disease, or infants and toddlers with any chronic problems, so lung problems, lung disease. And I have to talk about the RSV shot as well. This is not a vaccine. So a vaccine is something that teaches your body, remember, it creates those memory cells, teaches your body how to fight an illness. But the RSV shot actually gives you those memory cells. And so it's not a vaccine, but it is still a shot. It's still a poke. And this is for babies less than 8 months of age in their first RSV season, or babies 8 to 19 months with high risk conditions. I will say also, if this was around for my babies, I 1000% would have gotten it for them. But unfortunately, it was not around. When my daughter was born, there were like wait lists for it. So she did not get it. And then just some kind of things that I like to share with parents and adults about kids. These things are things that I have tried as well on my own children and love. So, and this is not, I'm not advertising for anything. It's just what I love. So nasal saline and suction, you can just go to Target, Meijer, Walmart, get some saline. I like the spray saline. I don't like the drops. I have actually tried the drops myself and they just go back to your throat and make you choke. So the spray you can put in one nostril, second nostril, wait a couple minutes, and then suction out with either a bulb suction for little ones or the nose Frida, or whatever your favorite suction is. Humidifiers, I would recommend cold mist humidifiers. They are annoying to clean. So my family and I, we just use the hot shower. We turn on a hot shower, close the door, let the steam do its magic, and then suction out. For infants, you can decrease the amount that you're giving them and increase frequency. For example, if your infant feeds 4 ounces every 4 hours, you can switch it to 2 ounces every 2 hours. I just tell parents, think about what you're like when you're congested. Like when I'm congested, I like choke on my, sometimes I like choke a little when I drink, or like it's really hard for me to breathe and drink at the same time. And so infants kind of have it a lot worse than we do. For children, especially kids age 1 to 3, they have a high risk of having low blood sugar when they're sick because they don't have the same sugar stores that you and I have. So my kids love popsicles when they're sick. The only time pretty much my kids get juice and popsicles and all that fun stuff is when they're sick. So my kids do like being sick sometimes. And then the last thing I would add is everything is for comfort. So fevers are a good thing. Fevers are your body's natural way of fighting infection. And so my daughter will like party all day when she has a fever. And when she stops partying and has a fever, then I give her ibuprofen and Tylenol. Sorry, it took longer than I wanted to.
No, that was all such wonderful information. The last thing I'm going to say is that when my kids are sick and I'm like, oh, what else should I do? I call Dr. Ash. Actually, I usually send her a text message like, I've done these things. I know I'm a doctor, but like when you're doctoring your own kids, it's so much harder. What should I do? And so I trust everything she says, and it's all the same stuff.
Thank you.
And I completely agree. So Dr. Huang, any last words?
Yeah, I think just protect yourself, the vaccines, there are a lot of, not just the flu vaccine, the COVID vaccine, there are now RSV vaccines for older adults. So I think definitely the kids we talk about, but those age 60 and older or 75 and older, 60 and older who have medical conditions, there's RSV vaccines that can protect them. And it can also protect, the young kids, because when you vaccinate the grandparents, then when they're seeing the young kids during the holidays, you get protection both ways. So we're really more attuned to a lot of these viruses now because we can test for them, but we also know that there's a lot more different treatments and vaccines that protect against them. So, take advantage of them. Yeah.
Yeah. Thank you so much. Thank you to the health department. Thank you to Dr. Ash and Dr. Huang. We'll see you next month, and Happy New Year.
Thank you.
Thank you. Yeah.
Thank you, everyone.